Sleep apnea. Why I chose this topic. Sleep apnea runs in my youngest son's family. His grandpa wore a sleep pap to bed every night. I chose this topic because it's important to me. I want to be best prepared if my son or his father ever starts showing symptoms. Learning the warning signs can lead to early diagnosis and treatment. Many people live with sleep apnea without realizing that they have it, so increasing awareness is important. What is sleep apnea? Sleep apnea is a sleep disorder where breathing repeatedly stops and starts during sleep. There are three types. Obstructive sleep apnea, which is the most common type, is when the throat muscles relax, blocking or narrowing the airways. Central sleep apnea, a less common form, is when the brain doesn't send the proper signals to the muscles that control breathing. And then the third type is complex sleep apnea syndrome, which is a combination of both OSA and CSA. Symptoms of sleep apnea: loud snoring. You, partner, or family member may hear a pause in breathing, gasping or choking during sleep, morning headaches, excessive fatigue, memory and or concentration problems, irritability and or mood changes. Day-to-day effects of sleep apnea: trouble staying focused, slow reaction time, forgetfulness, memory or retention problems, moodiness, increased risk of depression, increased anxiety, a higher risk of car accidents, and a higher risk of work-related accidents. Sleep apnea and occupation. Healthcare workers, first responders, truck drivers, and factory workers who operate heavy machinery often work long and irregular hours, leading to poor quality of sleep. These symptoms can increase the risk of workplace accidents. Additionally, night shift workers and swing shifters often have disrupted circadian rhythms, making it difficult to get consistent sleep, further complicating sleep apnea. The latest research. A study done in 2026 at Marshall University found that when oxygen levels dropped from obstructive sleep apnea, it can trigger inflammation in specific immune cells, leading to insulin resistance. Mice were used in this study. Scientists removed the immune cells and found that the mice were then able to regulate blood sugar better, and inflammation in the liver significantly decreased. Although this doesn't help treat sleep apnea itself, it could become an important treatment for some of the health conditions that occur alongside sleep apnea. A continuous positive airway pressure, which is the CPAP. The CPAP is a device that uses positive pressure to keep the airway open. The mask must be worn every time you sleep. If you don't wear it, it's not going to work. Some benefits: it improves your sleep quality, it reduces snoring, it improves mood and cognitive functions. Some possible side effects of the CPAP are dry mouth, runny nose, congestions, and nosebleeds. The CPAP is a common form of treatment, but it's also important to remember that there are alternatives to the CPAP. Finding and treating the root cause. Although CPAP is a common and very effective treatment, it is not a cure for sleep apnea. It manages the conditions. A proper evaluation by a professional to identify the cause of the airway obstruction is the first step in determining the most appropriate treatment. Surgery may be recommended by removing enlarged tonsils or excess throat tissues that block the airway. Also, oral applications can reposition the jaw, helping keep the airway open during sleep. Some lifestyle changes that can improve sleep apnea: maintaining a healthy weight, exercise, healthy diet, consistent sleep schedule, avoiding alcohol, and limiting your coffee intake. Conclusion. Sleep apnea affects more than just sleep. It can impact your mood, your memory, your concentration, and your overall health. Early diagnosis and proper treatment is essential. As research continues, new treatments may improve outcomes for people living with sleep apnea.